Hi everyone, so I'm Julie and I'm with the Halifax Refugee Clinic, and I'm also here on behalf of a collaborative community project, Invisible Women Concrete Barriers, which I'll be speaking a bit more about. First of all, I'd really like to thank Sharon and Sandy for having us here. I think it's very important that vulnerable and marginalized populations like refugee claimants really get to participate in these kinds of discussions and have a voice. So thanks a lot for that, and I'm very glad to be here. I'll try to keep the first part of my presentation to a minimum. I tend to spiel, as some of you might know, because the end is going to be a discussion with Yvonne and Paula and a kind of a first voice perspective on some health challenges and mental health challenges during the refugee determination procedure. I always find it good to go back to the very basics, and I apologize to those of you who already know these things, but I'm going to go over the definition of what a refugee is. So a refugee, as you guys can see here, is a person with a well-founded fear of persecution for reasons of race, religion, nationality, membership in a particular social group, or political opinion, who is, and I'm paraphrasing, outside of his or her country of nationalities and whose state authorities are unable or unwilling to protect him or her. So that's the international definition of a refugee as we find in the Geneva Convention. So that definition has been incorporated into Canadian law as well. And in Canada, and it's important for you guys to realize these distinctions. That's why I'm giving you guys a little Refugee 101. In Canada, we see two types of refugees. So when we speak of refugees, we speak of overseas refugees and inland refugees. So overseas refugees are those refugees who have been determined to be so overseas by the United Nations and who come to Canada as resettled refugees, so either government assisted or privately sponsored. When they arrive in Canada, they obviously have a lot of the same inclusion and settlement and mental health barriers and obstacles as other newcomers and as refugee claimants. But when they arrive in Canada, they have permanent residence, so their status is secured. Now, a refugee claimant is a little bit different. A refugee claimant is synonymous in a lot of other jurisdictions with the term asylum seeker. In Canada, we use the term refugee claimant, and that's someone who arrives on Canadian territory and who asks for the protection of the Canadian government because they feel they meet that definition. So what ensues there is a long procedure which culminates in a hearing in front of the Immigration and Refugee Board, at which point it will be decided whether they do meet the definition of the refugee, and so will be allowed to stay, or not. And I mean, this could be a whole other discussion, but that usually entails eventual removal from Canada back to the country of origin. So you see up here, I've got a little bit of a comparison between refugee claimants and sponsored refugees. So refugee claimants, asylum seekers, are not permanent residents. There's no access to federally and provincially funded settlement services because they're not permanent residents yet. They have a conditional status. In Nova Scotia, they're not eligible for legal aid. There's no legal aid for refugee and immigration matters, so that's why organizations like the Halifax Refugee Clinic exist. Otherwise, people would have to go through this whole very challenging and complex determination procedure unrepresented and alone. As far as health services, they're not eligible for MSI until they get refugee status or permanent residence, and they're covered under the Interim Federal Health Program. So that could be a whole other discussion. I won't get too much into that, but it's federal funding, and it usually involves pre-approval, and not all healthcare practitioners accept it. So sponsored refugees, government-assisted refugees or privately sponsored refugees. They're landed upon arrival. They have access to federally funded settlement services. And they do have IFH, Interim Federal Health, for the first few months, but then are able to access MSI. So refugee claimants face the same basic obstacles and challenges as other newcomers, including overseas refugees to Canada. And Toyin gave very good examples of these earlier, but with many added barriers and difficulties. And I think it's important to realize this. There's a lack of access to health services, especially appropriate mental health services. There's also, because the refugee determination procedure involves telling your story, explaining to the government why you're a person in need of protection or why you're a refugee, there's a need to relive difficult experiences. So you can imagine you've, passed through incredibly horrible and traumatic things, and there's a need to tell them to many different people, to an immigration officer when you first arrive, to your counsel, to your lawyer, to other people preparing your hearing, and then in front of a board member who asks you very challenging and sometimes, questions tinged with suspicion, in order to actually prove that you're a person in need of protection. So that's something that's very difficult for people as they go through this whole procedure. So like all refugees, refugee claimants have sometimes survived torture, sexual assault, civil war, persecution. There's also a feeling, because their status is not secure here, a feeling of being unwelcome in Canada and defensive of their presence in Canada. Many clients have told me that they feel the need to defend themselves. Why are you here? You're not a permanent resident. Because their permanent status in Canada is uncertain, so they're in limbo. And you can imagine if it takes a year or two to come to this decision, all that while you don't know if you're going to be deported in 6 months, if you're going to be allowed to stay, if you're going back to a very, very difficult or persecutory situation. That's very, very difficult for people. The other thing that I think we have to remember when dealing with refugees and not immigrants is refugees had no choice but to flee their country. For immigrants, it's a choice. There are barriers when you arrive here, but there has been a choice to come to Canada and make a new life. For refugees, there was no choice. So all these feelings of homesickness, of not being in the right place, of identity, are very confusing for people as well. And so when we do think of refugee claimants, I think we have to remember that there's a traumatic past, an unstable present, and an uncertain future. So any work we do around that, whether it's in the health field or with settlement services, has to remember this very kind of singular identity of refugee claimants. So some of the actions that we've been taking as an organization and as community members, because emergency mental health care is covered by the Interim Federal Health Program, but not regular counseling. So we've established some partnerships. We have a roster of volunteer psychologists who come and exceptionally take on clients, which is amazing, and we're very, very happy about that. We've also established a partnership with the Capital District Mental Health Program, and that just started last year, and we're very grateful to them as well. Sometimes it's involved raising funds to pay for psychological services for certain clients who are very in need. And as you can imagine, that's an added burden for a small organization or for a client who doesn't necessarily have a lot of money. We're also involved in a collaborative community project, Invisible Women Concrete Barriers. So Invisible Women Concrete Barriers started in 2007 with some focus groups, and there were about 10 women varying between 23 and 45 years of age, and they were clients of the Halifax Refugee Clinic, and this was done in partnership at the time with the Red Cross. Later we were joined by the Atlantic Council for International Cooperation, the Atlantic Center of Excellence for Women's Health, and the Salvation Army ARIS project. So there were varying countries of origin, varying family structure and education level, and the contributions from the women's community were coded into these 4 categories, which you'll see: medical and health, education, employment, settlement, support, rural perspective. And then we had 2 policy roundtables. And the prioritized barriers included health coverage for babies, to educate health professionals, affordable housing, ESL classes, the creation of a support center, a resource center, a refugee survival guide, better access to mental health services, and talking about partnerships and sustainability. So I'll make this quick. These are some of the actions that have been taken. I'll let you guys read it up on the screen. And we're going into our 4th year at the moment. And this year we're really concentrating on access to health care, especially around the Interim Federal Health Program, and especially with regards to mental health for refugee claimants. So I hope I went through that quickly enough. There's going to be a little bit of a question and answer. We find it's more comfortable to do it in that format with Yvonne and Paula. And you heard the bio, but Yvonne and Paula have now been here for 3 years, actually. And they are permanent residents now, although it has been quite a long road to get there. And so Yvonne, do you want to come up here and answer some questions?
Just one.
Just one question. Yvonne told me earlier that I should just ask her one question and then go directly to her daughter. So Yvonne, tell me how you felt when you first arrived here.
Well, I'm going to try to explain. It's very hard, right? So I have been 3 years here and has been very, very hard for me. I feel homeless, and I still feel homeless, helpless, because, how can I explain? Sorry, it's very hard, right? Well, sorry. I want you to understand, some refugee has to be here. I don't have choice because I love my country. I am from Mexico. I love my weather, my family. I am so close to my family.
Your food.
My food. So I really want to be in my country, but I can't. Yeah, because somebody tried to kill me. I tried to kill my daughter. So that's why I am here. So. And when I arrived here, I tried to ask somebody help me, but in different places, they closed me the doors because I was refugee. So it's a big difference, immigrant and refugee. So sorry. It's hard to explain, but it really helped me. I don't know what more to say.
I'll ask, how did you feel about the access that you had to health services, and especially mental health services?
Well, I didn't have access. I wasn't able to have some kind of help. Well, thanks to YWCA, they really helped me, and they pay for how do you say? Psychologist. She really helped me for myself, my hearing. But I think we need more because today I have a lot of fears. It's hard. I don't know how to explain, but it's very hard because, for example, my daughter, if she sees some some police officer, she started to shake, and she hugged me, and she said, "Please, ma'am, hide me." Right? So, and nobody helped us. And I think it's no. It's hard. Sorry. Do you want to explain, please?
Sure. See, this is what she means. Now she's letting Paula take over. Tell me how you first felt when you came to Canada. How difficult for you was it to make the transition?
Well, it was really hard, but at the same time, at first I didn't feel it because it was like I was only 12 years old. So it was like if you were on a vacation at first, like you were just like going to meet for the first time to see the snow and stuff. But after a while, you start to get the idea of you're gonna live here. You're trying to run away from your own country, from your own people, and just try and hide. It's kind of hard after you think about it for a while, or you get used to the idea of it. It really affects people in that way, emotional, and you get depressed, and that's bad for the whole health. So yeah.
What about in school? Did you have any difficult experiences there, kind of integrating?
Yeah, it was more difficult for me at school because you're used to how can I say it? Here, the schools here in Canada are a lot more different than Mexico. From the structure, from the schools to the teachers, how they teach you and stuff. it's at the same time, it's more easygoing, but they respect the best of you. And when you don't know the language from the country, it's kind of hard to give your best when you don't know what's going on. So, and to like make friends at first is really hard. I'm very thankful to some of my friends right now because a simple hello or a simple hi can make up such big difference. Like, it can make you feel more confident when no one talks to you. You're like, nobody wants me here. Like, you feel like you're worthless. Like, nobody cares about you. But with a simple hello, you like feel like you can do anything. Like, just say hi and make friends. It's kind of hard to explain, like, for a teenager view to like, it's kind of hard to say it.
It's a good perspective you're bringing, though. That's. And I have one last question for Yvonne. You're not off the hook yet, Yvonne. Because I touched on it a little bit when I was introducing this, and I know that we've had conversations about it before. I want you to explain to me what it was like reliving your very painful story in an 8-hour hearing.
Oh my goodness. I feel, of course, very bad. And the government treat me, sorry, I have to say that, but the government treat me like a criminal. So I am here, I don't know, I am here because I'm not going to take your job. I'm not going to take your food, right? I'm going to try to make my own food, to earn my own money. But here you feel like that. The government always treat you like that. So you are a liar, so you don't deserve to stay here. And you have to prove and to prove and to prove. It's very hard. So 8 hours I have to try to explain why I am here. In some moment, I want to say to the judge, please, I want to go, bye. I am not a criminal. Why you don't treat the same? The people try to kill me. Why? Why I have to pass for this? For this? Sorry, I can't.
Yeah, I just wanted you guys to hear that it is just such a very different experience having to justify your presence here as a refugee claimant as well, and also having hanging over your head the fact that you might not be here and you might be back in a very troubled situation in 6 months' time. So when we talk about mental health for refugee claimants, to always kind of remember that there's that limbo and that uncertain future that comes and compounds all the other obstacles that other newcomers and refugees would face upon arrival to Canada. My time is up, but I'm just going to leave this on the screen for a while. I'm not going to say anything, and these are possible solutions and things, you know, things that we really need to think of when we're dealing with these issues. Thank you very much, and I look forward to the rest of the day.